Bueno, antes de iniciar, queremos agradecerle su presencia en esta capacitación de Universidad Levet. Está con nosotros Brenten Kinnison, el vicepresidente de Ventas Internacionales de UreSil. Y el día de hoy, en colaboración con Universidad Levet, nos presenta un entrenamiento de UreSil. Brenten, is everything ready for you? You can start whenever you want, please.
Let's start. I'm going to present today on the UreSil portfolio of products. Just keep in mind that all of this information will be sent to you in PowerPoint training, and everything that I present on today will be available for you to reference. I'm going to share my screen and start the first presentation over catheters. But before that, I want to just give you a brief overview of UreSil as a company. UreSil, the name sounds like it's for a urology company, and we are not a urology company. We are a radiology, specifically interventional radiology company. UreSil stands for urethane and silicone, and that's what our majority of our products are made of. We were founded by a vascular surgeon in the late 80s and branched off to Division B and started a privately held company in Chicago, Illinois, and basically pus, anything in your body that needs to come out, we are experts in removal of that. So moving forward, we will start with the drainage catheters, and I'll share my screen. Actually, first I'm going to share this, and this is kind of an overview of our main call points here. So this will also be available for you. So on the left side right here, these are our product codes, and all of our products. These are the different departments that these products could be used in. The good news is all of these products will be used by the same doctor in each of these departments. Besides the bottom down here in the OR, ER for our Thorvent and plastic paracentesis bottles. Now, the plastic paracentesis bottles are on here, but you don't have access to sell those. They're not CE marked. We have a 510K exempt, but I think the pricing is only applicable for usage in the United States. There's other applications that they use in Latin America that basically it wouldn't be feasible financially. So you have the ER thoracic vent down here. That will be a separate product from all the other, but it can be used in all these different departments. So starting with drainage catheters. Drainage catheters are, these are for non-vascular drains. There's vascular catheters that I'm sure you guys sell, but these catheters are for the removal of fluid from areas within your body, like an abscess, or in your liver, or in your kidney, or your breast, or another area that you're trying to infect from the body. These are a lot throughout the day, throughout the weeks. So when you get a nice account, it comes in every month and in high volumes. So there's different kinds of catheters. There's a general purpose drain. And general purpose is just for just how it says, general aspect. So it's generally draining from an area within the body you may have an infection after surgery. You may just develop an infection and you need to go in and get it removed. So that's our general purpose line. The 6 through 16 French, a lot of companies like Boston and Cook don't have the large array that we do. So some have 6 through 12 French. They don't have a 14, don't have a 16. We can offer the most range of French size catheters. And I'm not sure how everybody's education is on French size and gauge size. But just briefly, French size, the smaller the number, so 6 is going to be a small catheter, 16 is going to be a larger catheter. Not length, but larger in diameter. Gauges are different. if you sell needles or something, you may have a 14 gauge needle that's bigger than a 22 gauge needle or 20 gauge needle. So French size goes smaller. The size is the smaller the catheter. And then we have, so that's just a general. This is just an overview to start, and then I'll get into specifics on each catheter. The mini pigtails, you're going to run into Cook Medical has a product called the Dawson Mueller. That's their trademark name. Ours is just, we call them a mini pig. So a regular pigtail is a bigger sized. This is a smaller sized pigtail. We sell them in the regular lengths, and we sell them in short lengths. Then we have our UltiFlow catheters, which are larger 14-16 French with a special lure-like attachment for aspirating and flushing. And then we go all the way up to 20, 24, and 26 French for large, very pancreatitis, thick fluid that you're removing. It's almost like pudding-like substance where it's hard to get out. The doctor knows there's a huge infection in there and it's very thick and they need a large drain. So the 20 plus large bore drains are smaller volumes, not as high. The general purpose are going to be your most commonly used everyday product that the doctor will use. Then we have the biliary catheters, and biliary stands for liver. We have nephrostomy catheters, which stands for your kidneys. We have some longer length for patients. We have what you call an in-use stent or a nephroureteral stent catheter. And that's basically used when there's a blockage from a kidney stone and you're trying to get fluid from your bladder to your kidney. And there's an obstruction there. So it's a double pigtail that goes in and can bypass that blockage. And throughout the presentation, take notes on anything that you have questions about. And at the end, you can shoot your questions to me and I can answer those. So general catheter use. This is the GP catheters. The primary usage is for your abscess biliary nephrostomies, and then the secondary usage that they may use pigtail catheters is pleural effusion, paracentesis, thoracentesis, or a pneumothorax. Pneumothorax is a collapsed lung. Paracentesis is a fluid in your abdomen that the patient is like a cancer patient or an alcoholic or a drug user. They may have hepatitis or HIV. They have to come to the hospital every week, sometimes every other week, to get fluid removed. And they basically have to do this for the rest of their life. The thoracentesis is your lungs, fluid that builds up on the lungs. Lower volumes, they take off maybe a liter at the most. And then the pleural effusion is a catheter that they'll put in the abdomen that they go home. Your biggest competitor is a Pleurex device. And those are for long-term use. So when you're talking about the catheter, or the doctor is interested in a catheter, there's all these considerations of why they want to choose your catheter. And just background on drainage catheters, they're not changing the technology that they're using. So whatever they're currently using, it's the same concept as what you would be selling them. There's no difference in the clinical aspect of how they're getting access to the abscess to drain. So it's a commodity product in a way. Each catheter has different characteristics that may make it better than the other. So they're going to consider the stiffness of it. How does it feel when they insert it? Do they have centimeter markings on it? Is there radio opaque markers? How does it lock? How does it track over a wire? So they'll insert these either with a trocar, where they'll stick it directly in under ultrasound, or they'll use it under CT guided or fluoroscopy, and they'll use an access kit and go over the wire. So all these aspects are what they're going to look at in determining how they prefer your catheter over the competitor. The most common competitors are Boston Scientific and Cook. And again, here's the call points for all the products that we offer. So the good news is the doctors that you may talk to in CT, they go to specials or interventional radiology and do procedures in there. So majority of the time you can find out what department you have the best relationship, talk to the doctors in there, get them to try it in there, bid on a tender, win the tender, train that staff in CT, train the staff in ultrasound, train the staff in interventional radiology. So one of the biggest considerations that a doctor will, when he or she is trialing your product, evaluating your product, is they'll want to figure out how it feels when they insert it in the patient. So they're going through, sometimes the liver is very cirrhotic, so it's hard, and the catheter will accordion, meaning it will, as they're inserting, it'll back up almost like it's an accordion, and it'll be difficult to insert. So with our material, what we've done is all of our catheters are hydrophilic coated. So that's basically like a lubrication that's on the catheter that allows it to insert into the body and slide in. We also have a polyurethane material that's a combination between what we used to have as a soft material and a stiff material, and we made it into one. So that's what we call our new origin drain. So our catheter has a trademark name, Origin. Argon has trademark name as a skater catheter. And Boston Scientific has the Fleximo, or Cook has the all-purpose drain, or Angiodynamics has the Obsession. So ours is called the Origin. What makes ours different from the competition is we have a larger hub. All of our catheter hubs are a 16 French. So that will promote, if a catheter will occlude where it won't drain, and it usually happens at the locking mechanism, which is the hub. So we increased our inner diameter to 16 French. Even if you have a 8 French catheter, it has a 16 French hub. Our locking mechanism is an easy one-handed locking mechanism, so the doctor can place it and lock with one hand. Everybody else's catheter, you have keys, you have some sort of difficult locking mechanism. So one of our biggest features is the way ours locks. Moving on to our hole size, they'll visually want to see the holes. Cook Medical, which is probably going to be your biggest competitor, has small punched holes. Our drainage sizes are double Cooks, and it is skived cut, meaning it's not punched directly down, it's cut from the sides and then down. So it facilitates the flow into the holes. If our catheter is not locked, once it's attached to a bag, it's still air seal tight, meaning it will still pull fluid. And that's in the locked or unlocked position. Some of your competitors, you have to actually lock the catheter before you can get fluid to pull. And then they'll determine, the stiffness, and then we have some unique products. Getting on to our the working length and the total length. So some of our competitors will reference a length that's a working length, and some will reference a total length. We don't have any different. We didn't come to the market with something that was completely different than what the market leader is, Cook and Boston, right? So ours are the same lengths, the same total lengths, and the same working lengths, but each manufacturer references one or the other. So sometimes the doctor will say, "Oh, I need a 30 cm," and yours is only 24. But they may be referencing the total length and not the working length. So on all of our catheters, on the packaging, it shows the working length, and in the product code, it tells the total length. So for example, this code GPL2-1030, 10 references the French size, and 30 references the length from the hub to the catheter tip. 10 French, 30 centimeters. Now, that is the total length. The working length will be on the actual inside the catalog that you get, and you'll have access to that, a full catalog. It'll tell you the product code, which will tell you the total length, and then it'll have the size and length in the middle that tells you the working length. So in this specific catheter, the total length is 30 centimeters, and the working length is 21 centimeters. This is a blown up version of the catheter tip. So at the top left, you'll see the large drainage holes, and you can see what I was referencing, the skived cut. So the middle of that is punched and the sides are skived. So it's a skived cut hole. Cook would be just a hole, just a punched hole. We have a unique tip taper that allows for insertion, smooth insertion, so you don't have that accordion. And then all of our catheters, again, are hydrophilic coated. So this allows to get patient comfort, it tracks well, slides in easy. They're made from a biocompatible material, polyurethane. It's soft and flexible, it's kink resistant, minimizes tissue irritation, and it's fully radio opaque, meaning they can visually see it. So here's the hub. And this is an older picture. Now our catheters have a clear hub, it's not white, and they have a black sleeve instead of that blue sleeve where it says drain. That's blue, this is now black, and the catheter hub is white, or is clear. So this is locked right now. And it's like I said, it's air seal tight, it has a low profile, it has the largest inner lumen on the market. So right where that blue sleeve is, you can see that increase before it gets inside the white part there, where it increases to the 16 French that allows for the flow and doesn't allow that occlusion there. And then you see it attached to a bag that's air seal tight once it's attached. There's no keys, there's no levers, there's no sleeves to pull over. It's just an easy locking. So at the bottom, it's unlocked, and at the top, it's locked. So all you do is slide it back, and it's locked. You'll hear it click. It's easy to unlock as well. And you can, if you want to save suture, there's a ring on the back you can wrap around and then slide, and it keeps the suture inside there. A lot of times they'll just cut that off once they tighten the pigtail. And when we're done with this, I'll show you how to lock and unlock it at the end. This is to unlock it. There's a tab right there. You just push down with your finger and you slide the hub out and it unlocks it. The only time they're going to unlock it is if they need to reposition it or if they want to remove the catheter at the end. But a lot of doctors just cut the catheter and pull it out. So here's the key features again. And the good news is these features for general purpose are the same for all of our catheters. So for our biliaries, our nephrostomies, our NU stents, our large catheters, our small catheters, all catheters, same features. Easy locking mechanism, it's kink resistant, all hydrophilic, larger hub, air seal tight. We have centimeter depth markings. The material that it's made of is a proprietary product that we have called polyurethane. Soft, flexible, and kink resistant. It resists that accordioning, minimizes clogging and extrusion at the hub, and it's an easy locking and unlocking mechanism. And here's a new version of it, blown up. You can see the hub is clear. You see the black sleeve. We added these depth markings on it. And this is available in all of our catheters now. So just getting into the different drains, this is more just education on what they're draining. The nephrostomy is your kidney. So they're going to make a passageway through the skin into the kidney with a access kit. So majority of them will use a Boston Scientific product called the AccuStick. We have a competitive product in ours that's called the PosiStick. And that's at the end of it's the back of the catalog that you guys all have access to. So they'll find an access needle, they'll stick a needle in, they'll pull the needle, and there'll be left a cannula. They'll insert a 018 wire down into the kidney. They'll pull the needle out. They'll stick a dilator. They'll pull the wire out. They'll stick a bigger wire like an 035 or an 038 down into the urinary tract, down into the kidney. That they're basically removing an obstruction that the kidney is not allowing it to drain. So they're removing that fluid and they're gaining access with a wire, which is called the cell dinger technique. So here's an image of it. The top has a needle. They throw a wire. They pull the needle. They throw the catheter over the wire. Then they pull the wire out and they attach the bag and then drain the fluid from that area. So that's a nephrostomy. Next is biliary. Biliary is your liver. So this is a passageway into the skin that goes into the biliary tree. The purpose of this is to decompress or drainage of a blockage in the bile duct. So this is a temporary relief to some sort of malignant disease that the patient may have. Same access. They will never use a trocar needle because of bleeding in the organs. So they'll use this access small gauge needle to access the biliary tree. They'll throw a wire into it to the area that they need to drain. They'll pull out the cannula of the needle, and then they'll thread the wire down that dilator, usually an 035 or an 038. And then they'll thread the catheter over that wire, pull the wire out, and then they'll lock the pigtail and attach a bag, and they're draining. It's very simple. You won't have to teach the doctor any of this. They've done this for many, many years. So we're not changing any techniques. The only thing we're changing is the drainage catheter. These are your biggest competitors on the market. Boston and Cook by far is the most we see. Here's the market share for Boston is about 50% worldwide. They do have a restriction in their hub. They're not approved to use with alcohol. Ours, you can use alcohol. So sometimes they'll inject ethanol or they'll flush with alcohol to kill an infection. And the Boston catheters will disintegrate or break down. Ours will not. And they're usually pretty expensive. So here's a blown up version of theirs. You can see in the top right, they have that key. So they have to stick a key into the hub and twist it. And then if they cut that key off, they have no access to unlock the catheter. So they have to cut the catheter to remove. They do have Boston has a new catheter too called the Expel. That is like a twist lock. And what happens with that is the doctor will over twist it and it'll strip out and it won't be able to lock. This is the twist, the Expel. It was introduced in early 2015, but they had some issues with it and they pulled it back off. So they did increase their offerings. They don't have a 16 French in their Flexima, but they do have a 16 French in their Expel catheters. And this is what it looks like. So they added the depth markings and the hub at the top left there is a twist hub now. But that becomes stripped a lot and then it leaks. The second largest competitor is Cook Medical, which I'm sure you run into Cook a lot. They don't have the largest configuration like we do, the 16 French, the longer length catheters, the small catheters. They're usually more expensive. Sometimes they buy the market in other international markets. So they buy on price or the doctor was trained with Cook. Majority of the time, why you find they use a certain product is the doctor was trained. So in their education at their school, they were trained with Cook or they're trained with Boston. So they come to a new facility and they want what they were trained on. They do have smaller punched holes. And here you can see they have that lever. That's how they lock theirs. So they push that down, and then in order to unlock that, they have to get some sort of forceps or instrument and pop that lever back up. So what happens is they usually just have to cut the catheter. Angiotech or argon is now argon. They have the skater catheters. They are majority of their catheters are similar to UreSil. We have more offerings than they do, but they have an engineer that used to work at UreSil works for them. So they designed their product a lot like ours. They have some different, obviously the locking mechanism right here that you see is different, and they have in their hub they have an obstruction. The suture actually comes through the middle of the hub, which can cause leaking and an obstruction. At the bottom there, they have a pigtail straightener, that clear sleeve that's over the catheter. They'll push that down over the tip of the catheter. Some doctors like that. But at the top left there, you'll see that key clamps on the end of that, and then they break it off. So in order to unlock the catheter, you have to cut it. There's no way to reverse it if it vibrates. It's very difficult to unlock, and they also have a restriction in the hub. This is their catheter. Right there, they have to pull that sleeve up over the hub, and then it's very difficult to unlock. You have to use two people have to help unlock that. They recently acquired Navalist, so they have this catheter. You probably won't run into it. It's not very common. Same thing as Boston's. They twist it and it strips out and then leaks. And then the last one's Merit. They typically go a low price. They have depth markers. They have a pigtail straightener. But again, they have this key that locks over. It's very difficult to lock. It's easy to unlock because you just pull the key off. And they also have a sleeve that goes over the pigtail. Bard you probably won't run into. So I won't get into that. They have a catheter called the Navarre. It's not commonly used. This is a sheet that you'll have access to as well. It's a configuration of all the catheters on the market. You can see on the right side that is a argon catheter, the skater that has that post that runs through the middle of it. That's the obstruction. So you have fluid coming through there, and that post is hanging down the middle of it. It becomes clogged. At the top, it goes over all the hole sizes, how many holes each catheter has, if it's compatible with alcohol. And then all the catheters below are how each one locks. So I study the competition as much as I study UreSil products, because when I talk to a doctor and I find out what they're using, I know exactly what to sell against. So all the catheters, the first thing you want to show them is how easy ours locks and how it unlocks. And I recommend when you're at home or in the office to play with our catheter and be very comfortable with how it locks and unlocks. It's difficult at first, but once you get it, it's easy. And then you show the doctors, they think it's very easy, then they're not able to unlock it. You show them how to unlock it, and then it's very simple. The NU stents come in 8 and 10 French. This is another catheter specialty that we offer. There's only 2 competitors, and it's used for a blockage, of a kidney stone, a blood clot, or a mass in the ureteral tract. So the pigtail resides in the renal pelvis, the kidney, and the distal end resides in the bladder. So they're moving urine from one area down to the bladder. And it can be left in an external drainage or capped off to promote internal drainage. So each one comes with a cap. It's usually used in fluoroscopy. Same sizes as Cook, same size as Boston, 8 or 10 French, and they come in 22, 24, 26, or 28 centimeters. the difference between the sizes or the lengths are in between the two pigtails. So everybody's anatomy is different. Some may have a longer ureteral tract, so they need a 28 centimeter pigtail catheter, versus someone with a smaller anatomy may just need a 22. This is just why you would use it. It's good for temporary relief, but a lot of times the patient may need surgery. So that was a brief, fast overview of the catheter line. And at the end, I'll show a video. I'll share my screen of a video, and I'll demo how to lock and unlock the catheter. So next, I'm going to go into the accessories that we offer. So each catheter is connected to a bag, and we offer a bunch of different accessories. So this is our #1 selling product worldwide. It's called our True Close suction bag. So they come in 300, 500, and 1000 ml. The most common is the 500, the TCS 500DS, or the TCS 500D. And the difference in the D and the DS, TCS stands for True Close Suction, 500 stands for how big the bag is, and D stands for drain, and S stands for small. So the first one here, the first image, you can see the bellows at the top is small compared to the middle image, which is larger. The smaller bellows has more PSI, more suction than the larger one. And each bag has a code drain port on the bottom. So these are used for all your general abscess drains that they want to get suction. You would compete with just a typical gravity bag, a 600 ml gravity bag. And these are used, they won't use these in biliaries and nephrostomies usually, because you don't want suction on the organ. And the 1000 ml bag doesn't have a drain port. They all come with the 25-inch silicone drain tube that can be adjusted. You can actually cut and pull out the lure and reattach the lure to the bag depending on the patient. How some are taller, some are smaller. They don't want a long tube hanging out. They come with a clip where they can clip them on the patient's gown, so it doesn't pull the catheter out when they get up. And the PSI levels range from 2.8 to 4.5. So the DS has more PSI than the larger ones, which is 2.8. And so they'll attach the catheter, and then they'll take this bag and lure lock it directly to the catheter, squeeze the top bellow once, it activates the suction, and you squeeze the bellow again, it'll fill up with fluid, you squeeze it again, and it shoots the substance down into the bag. And if you look at that first image, there's a little piece of white tubing coming from the bellow down into the bag. That is an anti-reflex valve. So once you squeeze it, it won't allow it to go back to the patient's catheter. It goes directly into the bag. So again, these are high volumes. #1 selling product we sell. Here's a blown up version. The left is a small bellow at the top, and the right is a big bellow. Both have a drain port. It just unscrews, drain it, and then you screw it back on, and that's it. So these are all it's a closed suction system. It allows the patient to walk around. You're not connected to like wall suction. It has a dual anti-reflex valve, like I said, at the top there in the bag. That's that port that's coming out. And if they forget to squeeze it, it'll revert to gravity. And they can empty it so they can use it multiple times on the patient. And the other alternative is a gravity bag. This is what they'll use in the kidney and the liver. It's a 600 ml. Same concept, it's just gravity. It has to be lower than the drain. It wraps around the patient's leg. They use these for urine sometimes. And then it has a drain port on the bottom. Comes in boxes of 20. High volumes. A lot of usage. So that's the accessories. And then the last product is our pneumothorax kit for a collapsed lung. This could be very helpful right now with coronavirus. So this is a device that will treat a pneumothorax that's either caused by iatrogenic, which means the doctor causes it himself or herself doing a thoracentesis, a biopsy. Usually in CT, when they do a lung biopsy, they'll cause a pneumothorax. Or in surgery, a cardiothoracic surgeon will have a pneumothorax, and they'll treat it with this device. So it'll treat all pneumos. Iatrogenic, a traumatic pneumo, a spontaneous pneumo, a tension pneumo. So you get all kinds of this. This can be used throughout the entire hospital. The higher volume is going to be your emergency rooms. So you have a patient that comes in, they fell off a ladder, and they have a pneumothorax. The options that they can treat the patient now is to stick a chest tube and connect them to wall suction and admit them to the hospital. Or they stick a pigtail catheter and attach them to suction and then admit them to the hospital. With our device, they can place this anterior. It's a self-monitoring system, and the patient can get up and walk around. So we have tons of facilities that have a patient that comes in, they don't have any other complications. They have a simple pneumo or a tension pneumo or a traumatic pneumo, but they can walk, they're fine. They don't need to be admitted to the hospital. They place this device, they go home, they monitor it themselves. And then once there's a red signal diaphragm that I'll show you, once it stops moving with the pneumo is not releasing any, the lung is not evacuating any air. So the pneumo should be resolved. They come back to the hospital, they take a CT scan. If it's resolved, they pull this device off, they put a Band-Aid on them, and they go home. So this is just an image of the lung and large pneumo, small pneumo, and how they treat it. So at the bottom, you can see they stick a catheter in that space where that air leak is, and they remove the air from that, seals up, and then they pull the device out. So here's how the placement will. They're going to do this blindly. So they'll fill your clavicle, and they'll go in the middle. They'll go down to your second rib, and in between your second and third rib, they'll make an incision. They'll place this device in the pleural space. The air will rush up the catheter and deflect this red signal diaphragm up and down with each respiration. That allows the doctor, gives them visual confirmation that they're in the pleural space. They advance the catheter. There's adhesive sticky backing on the product. They'll stick it up to the chest wall, and it will be working perfectly just like that. But the key for this is it's only for air, no fluid. So if they do have fluid, it's the wrong device. It has a red signal diaphragm that goes up and down. It has a drain port on the bottom that you can aspirate fluid if they do get any unsuspected fluid. And here's a picture of it. So at the top, there's a red signal diaphragm. And I'll show you this at the end. I'll pull the device out. So it comes in a kit. Everything you need to do the procedure besides lidocaine is in the kit. It has adhesive on the side. It has a one-way valve, so it only allows air to come out, not in. If they send the patient home, there's 2 suture holes at the top that they'll suture down. And on our website, there's video of this procedure too. And it's all over the internet. This has been around since 1992. And it's very popular. It's used on all air helicopters in the U.S. and on our Navy ships, and our military have contracts for this device. So it's very popular as well. This is kind of an overview of the advantages of it. Again, I would start in the emergency room with a nurse manager or a doctor that you may have a relationship with, and I would show them. I would carry the video on your iPad or refer them to the website for the video. You bring a product in there and show them this, especially right now. We have a bunch of reps in the US that have been sending emails to their doctors with this because obviously the emergency rooms are filling up with COVID-19 patients. And this is a way, if you have a patient that does have an emergency, you don't have to admit them. You can send them home, and it's very popular right now. A lot of like ski resorts, hospitals that are in like mountains, where you have different pressures. If you have any cities that have surfers, they fall from it and have an accident with this, it's very popular. So the key features to this, it's a better option for the physician, better for the patient to treat it. It's self-monitoring with the red signal diaphragm, and again, I'll show you this visually. And it can accommodate all pneumos. So it's a small device, and the perception is it will only treat small pneumos, but that's incorrect. It's very informative for you to set up education. Once you get this into the hospital, I highly recommend you targeting all your areas of CT, the ER, pulmonology, and let them know that this device is available. They may see it on the floor, and educate the staff on how it's used, because a lot of times a new doctor will come to a hospital, they were trained with it or they used it somewhere else, they request it, they place it, the patient comes in to the pulmonologist or is admitted somehow, and the staff has no idea what the product does, and so they will remove it, they'll stick a chest tube in, and you won't see any more cells. So education is key with this device. And it's always new to somebody. Even though you may have it being purchased at a facility, it may only be used by one doctor, and you go educate that department, and 3 or 4 other doctors want to use this device. Okay, I'm going to share my screen and go over the locking mechanism. I'm going to show my webcam, and then from that, we can answer questions. I'm going to show you the catheter first, and then I'm going to show you the bags connected to the catheter, and then I'll show you the Thoravent. Okay, so at the tip, you have holes. It's difficult to show. There's the holes, the skive cut holes. I show the doctor the holes visually. To lock the pigtail, tighten this, tightens the pigtail. Centimeter depth markings. It's unlocked. The lock. Locked. Unlock. Push this tab down. I pinch this, and I pinch here, and then I'm going to push my thumbs together. Unlocks. Locks. Unlocks. So that's a catheter. Locks. Unlocks. This is what you want to play with at home to figure out how to lock and unlock it, so you can show the doctor when you're doing education. And then once they place that, they're going to tighten the pigtail, they'll lock it, and they will attach a bag. So either a gravity or a suction bag. This is a DS. It has a small drain, a small bellow. So once they're connected, this will clip to the patient, and then they'll squeeze this once, and fluid will come into these bellows. They'll squeeze it again, and it shoots down into this bag. And right here is the dual anti-reflex valve. So they actually have a drain port as well. When this becomes full, they just drain this by opening, and then drain it, and then they close it. So that's the general purpose drainage catheter to a suction bag or a gravity bag. And then we'll go to the pneumothorax kit. This is what it looks like, and everything is in the kit besides lidocaine. Looks just like this. We'll open it. Every kit has nursing instructions and IFUs. So they'll take a scalpel. They'll go mid-clavicular, and they'll feel down to the second rib, and they'll go to the third rib. They'll go right in the middle. They'll make an incision. We'll take this trocar that's in the kit. Here's the device. They'll insert through the top here. They'll pull these flaps back, and they'll insert. So they're going to insert in. Once they're in the pleural space, air is going to rush up this and deflect the red signal diaphragm up and down. So they'll advance the catheter as they remove the trocar. And now it's just like this on the patient. And it's working just like that. So I can walk around, I can go home. Once this stops moving up and down for an hour, the pneumo should be resolved. So each one of these has adhesive that will allow it to stick to the skin. And then there's 2 suture holes up here that they can suture in to the patient. If they get any fluid that's unsuspected, there is white foam in here on the sides, right here. That will absorb about 5 cc's of fluid. Any more, they take a syringe attached to the bottom, and they can aspirate fluid off. That's it. There's forceps in here. If they need to dissect the incision site a little bit, they can dissect. So I guess we can start answering questions.
Brenten and Christelle say, You told that Terraven is now very useful for COVID. Can you tell us how can we promote with the hospitals the use of this device?
Yeah, let them know that you have a device that can allow the patient to be discharged from the ER to treat pneumothorax. Because right now, everybody is going to the ER because of COVID, and the resources are limited and the beds are limited. So this allows it's an obvious emergency when you have a pneumothorax, but when the patient comes in with a pneumothorax, if they stick a chest tube in them, then they're admitted to the hospital for treatment. With the Thoravent, that allows the patient to go home with this device. So it frees up the bed space.
Okay, we have another question. Okay, as El Rivera asked, here in Mexico, for what I've seen, doctors use a lot of GP catheters. But I think he doesn't finish his question.
Yeah.
For nephrostomy, why is that?
There's no difference in nephrostomy and general purpose catheters. Only thing that's different is the length. So I have a lot of doctors that use the nephrostomies for general purpose or general purpose for nephrostomies. So the difference is okay. The only difference is more more working length or total length. So this is they're the same 10 French. This is general, this is nephrostomy, just longer. So sometimes you're gonna have a doctor that would rather have more length all the time, so they'll use a nephrostomy for their general purpose and their nephrostomies, or they'll use the general purpose for all of it. So there is no difference. Same pigtail size, same French size, just length. And the difference is 21 centimeters in length versus that's working length. So working length is from here to here. There you go. Here to here. Total length is from here to here. So when the pigtail's open, total length. Working length, here to here. It's the only difference.
Okay, Angel Sousa asked, is there a new model of GP?
This is it. This is the only model that we sell. Origin. It's been available for 2.5 years.
Okay. Cristel Estradas, in your experience, is there a percent of urologists using UreSil, or there is just radiologists?
I don't sell any to urologists. But different countries may have urologists doing the procedures that a radiologist would use. So it could vary by your country. Mexico, the urologist may place nephrostomy drains. In the US, they don't. It's all radiology because they're placed in with CT or fluoroscopy, and urology doesn't go into radiology in the US. So the percentage would be very small.
Okay, and Angel Sos asks, comparing with Cook, is that more flexible or softer?
So that's a good question because some will say, some doctors will say it's too soft, and some doctors will say it's too stiff. So it's just a preference. It's going to be softer than Cook's, but it's going to resemble Argon and Cook more than Boston.
Okay, and Asael Rivera asks, you say that the draining holes are bigger than the catheters from other brands. That will mean that the draining rate will be faster?
That's correct in a way, but what right here, this lure lock is a 12 French. Just lure. All lures are 12 French. So it doesn't matter how big or how many holes or how big your holes are. It goes to a 12 French here. So Boston actually goes to a 10.2 French. Cook has a 12 French, but what it will help with is sometimes it's chunky and you get occlusions. Right here, we increase to a 16 French inside this hub. So we help facilitate a better flow.
Okay, Asael also asks, do you have any study on that or something to give to the doctor?
We don't have any studies. Only studies that we have are on the Thor event.
Okay, Angel Sosa was disconnected for a minute and couldn't hear the answer of his question. Is comparing with Cook, is that more flexible or softer?
Oh, it's more comparable with Cook in regards to. So you're gonna have a Cook user that tells you it's too soft. You're gonna have a Cook user that tells you it's too stiff. So it's just their preference and how they perceive the stiffness of it. It's more comparable with Cook and more comparable with Argon than it's softer than Boston Scientific, but the doctor's going to have to try it and give his opinion or her opinion, and you may get from that doctor that it's too stiff, and then his partner may say it's too soft. So it's hard to determine, the stiffness of it.
With the more flexible of Cook?
Yeah, I would say it's more flexible than Cook.
Okay. Asael asks, usually which presentation doctors prefer, H or HB?
So we don't offer HB has been discontinued for almost 2 years. So we don't even offer. The only we offer is H. We used to have two different stiffness. A blue was HB and a white was H. And we had doctors say that the blue was too soft and the white was too stiff. So we made a combination of the blue and the white and made Origin. as one. Some of the product codes, there's only a couple that still keep HB code, but it's a white catheter. And the catalog that I sent has all the codes that we offer, and they're all going to be white H. Or if it has a code HB, it will be white.
In Mexico, the Boston Scientific nephrostomy catheter is used a lot. What is the difference to promote it? As Melissa.
What is the difference to promote our catheter versus the Boston catheter? I say the difference right here, the locking. With the Boston, you have this white key that you have to stick down and twist to lock it. So ours to lock is very simple, one-handed lock. Also, depth markings. And does she know or he know that are they using Flexima or Expel catheters? Like, are they using a twist or do they have the white key to lock the catheter? And you could also use that we can use alcohol with our catheters. So they'll inject ethanol and do an ethanol ablation, so where they'll inject an alcohol to kill bacteria that goes down into the area of the infection to kill the infection. The catheter will break down and disintegrate. Ours will not. And we do have a paper on that, a document that states that it's been tested with alcohol and it's compliant. And you could also say that we have 8, 10, 12, and 14 French. So we have more French sizes in the nephrostomy. And we also have a bariatric version of the nephrostomy that goes from basically the regular catheter is 28 centimeters and the bariatric is 40. So it's much longer.
Okay, Angel Sosa asked, could he show the code of the newest catheter GP?
And Christelle has this in a PDF, the whole catalog.
Okay,
And then
perfect.
the catalog has right here, it has all the features and how it comes. And then it says right here, that's the total length or the working length of the catheter. That's the French sizes of it. And then over here is the product code with the total length at the end. 08 is French size and 30 is the total length. This is the working length. And this is how it comes packaged.
Perfect. So I think it's the end of the training. Thank you a lot, Brenten.
If anybody has questions after they're reviewing stuff, you can pass my contact information and they can email me or they can text me, WhatsApp, whatever they need to use. I'm here to help you. So, and I can't go anywhere. So I have plenty of time to help.
Perfect. Thank you a lot, Brenten. So,
Yeah.
bueno, este es el final de la capacitación. Agradecemos mucho su asistencia y los invitamos a estar pendientes al resto de sus capacitaciones. And thank you a lot, Brenten, for your time. And, well, I'm going to finish the training.
Okay.
Perfect. Have a nice day, everyone.
You too.